Do you know what a field medic carried? Well, in this video, I'll discuss gear, identification methods, and what they carried. Other than the personal haversack or equivalent, medics were issued gear for their profession. Starting off with the base, they were issued pistol belts, a special type of suspenders called yoke suspenders, made with the purpose of carrying people without putting someone's strain on their backs, only when litter straps are attached. Then you have custom-made bags for medics, holding all their necessities, though airborne and officers only had one bag. Medics were also issued cattle straps to keep their kit together, though how the gear was worn is up to personal preference. There are many variations of the bag too. For example, the first pattern is closed with a leather strap, while the second and third use canvas straps. The third pattern uses press studs, while the second uses standard lacing. The standard lacings were introduced at the end of 1943 and early 1944. The lacings helped create a false bottom to make the physical bag smaller. Moving on to our identification items, starting with the helmet, medics did field modifications such as painting the helmet with Red Cross markings. Some units had a uniform look, while others had a frenzy of styles and shapes. For example, 2nd Medical had a uniform look. If you want to know more about them, click the video above. Back on track, sometimes stencils were used, but the majority were just hand-painted. The most common was a red cross with a circle around it. The first accounts of helmets being painted were made in North Africa around mid-1943, i.e. Operation Torch. MedDepartment.com states, "It had been noted that quite a lot of medical aid men suffered regular casualties. Interrogation with German POWs revealed that a single Red Cross brassard, worn on the left arm, was not always visible during combat, and such as it often was difficult for the enemy to correctly identify medics in the field. These reports created an investigation, and it took quite a bit to find a replacement. In the meantime, medics placed a second armband under their helmet net. Others wore 2 armbands on both sleeves. These actions were taken because, according to MedDepartment.com, quote, it seemed that the medical department was afraid of the enemy's reaction for the coming D-Day operations, June 6, 1944, whereby medics refrained from painting any Red Cross markings on their helmets." Moving down the body, all medical personnel wore Red Cross armbands. MedDepartment.com stated, "In order to comply with the Geneva Convention and Army regulations, a medical brassard was introduced November 25, 1924, for general wear by all medical personnel active in the field, as was the case with other armbands. This was also to be worn on the left sleeve above the elbow. It represented a red per scale cross, 3 inches by 3 inches, stitched onto a white regular cotton, 4 inches by 18 inches armband, which was fixed to the clothing by a large safety pin. And with each armband was stamped, issued by Medical Department, U.S. Army, in conformity with Article 21, International Red Cross Convention, Geneva, 1929. A small fun fact that MedDepartment.com also shares is, quote, on 16th of June, 1944, it was confirmed by the Chaplain Section Headquarters Communication Zone, ETO, USA, that chaplains and chaplains, assistants, enlisted men and warrant officers who were concerned exclusively with the removal of transportation and treatment of the sick and wounded were permitted to wear the Medical Department GC Red Cross armband." Moving to the torso, some medical personnel in February of 1945 had tabards, similar to German medical tabard. The goal was to increase visibility in the field and identification in the midst of combat. Patton also claims to have introduced the extra ID. Continuing with the theme of items that lay in the torso region, Red Cross personnel also had special dog tags, the differences being in the prefixes. According to MedDepartment.com, following the dog tags were introduced in the course of World War II. Army Nurse Corps, prefix N. Hospital Dietitian, prefix R. Physical Therapist, prefix M. Contract Surgeon, prefix CS. A bit more grim, special tags were made for unidentified servicemen who are found deceased. The substitute would be marked with an X, and then the number associated with the corpse. Now in the pocket, the Geneva Convention of 1929, issued out on July 27th of that year, also introduced a unique ID card. For reference, the standard GI card was 3-fold, but the Geneva Convention was a 2-fold, at least the first patterns were. The second pattern ones were similar to a late war US GI ID card, but with Red Cross markings. During World War II, the U.S. military created a tech or technician rank for people with special training. These grades were the normal chevrons with the T, standing for technician, added by the War Department Circular No. 5, dated January 8, 1942. Quote, they were respectively technician 3rd grade, technician 4th grade, and technician 5th grade. The exact medical roles of the technician rank were given to veterinary technicians, x-ray technicians, medical technicians, dental technicians, medical laboratory technicians, pharmacy technicians, surgical technicians, sanitary technicians, and medicine maintenance technicians. Though tech ranks were most likely saved for the rear, Doc Felix of the 5th Ranger Dog Company was a normal corporal without the T label, even in the reports, alongside a few other rangers in the medical department. If you have evidence against that, please comment below. Inside the bag, privates carried in the right pouch surgical plaster, bandage scissors, medium set of safety pins, burn injury set or boric acid, eye dressing set, iodine swabs, white adhesive gauze bandage, compressed gauze, triangular bandage, tourniquets, type 1 insert, and the metal container. And in the left pouch, pencils, first aid dressings, litter straps, emergency and medical tags. Non-commissioned officers carried 3 half-ounce vials, acylic acid, otherwise known as aspirin, used to reduce pain and fever inflammation, a cathartic compound used for its laxative effects, a 1-inch by 5 yards of surgical adhesive plaster, a pencil, large safety pins and medium-sized safety pins, a thermometer, a burn injury set, eye dressing set, iodine swabs, morphine tubes, sulfadizine, white adhesive gauze bandages, a field tourniquet, type 2 insert, litter straps, and emergency medical tags. And in the left bag they carried absorbent cotton, 1 yard by 36-inch plain sterilized gauze, compressed gauze, and a triangular bandage. Medical officers carried almost the same exact things as a non-commissioned officer, except they had self-humidified crystals and a complete medical officer's tool case. Paratroopers also carried a lot of the same things that a medical officer would carry, except they also had afidofenadine, which is a pain-relieving, fever-reducing drug, atabrine, used to fight malaria, and glycyrrhizide and opium compound, used as a cough suppressant. As previously stated, medical officers and airborne personnel were issued an instrument case that each contained one of each of these. The actual canvas case itself, the metal case for the scalpels, a straight, sharp-pointed scalpel, straight Abbey forceps, straight Jones forceps, straight tissue forceps, operating knife, a regular surgeon's needle size 6, regular surgeon's needle size 10, uterine needle size 5, half circle 6, operating scissors, and 3 sizes of silk sutures. Thank you for watching and have a wonderful day.